As a foreigner in Sao Paulo City, seeking medical attention when you're not familiar with the local healthcare system and language can be daunting. Thankfully, teleconsultation is now a viable option for medical consultation, making healthcare more accessible and convenient for foreigners. Teleconsultation refers to the remote delivery of healthcare services using communication technologies such as video conferencing, phone calls, or messaging. With teleconsultation, you can consult with a doctor from the comfort of your home, office, or hotel room, without the need for physical contact and risks of contamination with virus diseases. Teleconsultation is a convenient option for medical consultations in Sao Paulo, especially for foreigners who need an English-speaking doctor, and given the city's large size, long distances, heavy traffic, and crowded healthcare facilities due to its big population. Transmission diseases in Sao Paulo, updated 2023. Sao Paulo City is a bustling metropolis that is home to over 12 million people, making it one of the largest cities in the world. With its dense population and warm tropical climate, the city is prone to several transmission diseases. Here are some of the transmission diseases that can be diagnosed through telemedicine. Dengue is a viral disease transmitted by the Aedes aegypti mosquito, and it is endemic in many parts of Brazil. Data from epidemiological surveillance of Sao Paulo City Hall about dengue. In the first 3 months of 2023, there were 3,190 reported cases of dengue in Sao Paulo City. In 2022, there were a total of 11,910 cases and 2 deaths. Leptospirosis is a bacterial disease transmitted through the urine of infected animals, especially rats. Sao Paulo epidemiological surveillance reports shows that in 2022, there were a total of 203 reported cases of leptospirosis in Sao Paulo City, with 19 deaths. In the first quarter of 2023 alone, there were 82 reported cases and 7 deaths. Meningococcal disease is a bacterial infection that can cause meningitis and sepsis. In 2022, there were a total of 96 reported cases and 19 deaths in Sao Paulo City. In the first 3 months of 2023, there were already 32 reported cases and 3 deaths, indicating a potential increase in cases for the current year, accordingly to data from epidemiological surveillance of SP. Influenza B is a viral respiratory illness that can cause fever, cough, and body aches. Epidemiological surveillance influenza B reports shows that in 2022, there were 57 reported cases and 1 death in Sao Paulo City. In the first 3 months of 2023, there were already 84 reported cases and 1 death. Diarrhea and foodborne illnesses are common in Sao Paulo, with surveillance data from Health Department reporting 25 outbreaks and 497 cases in 2023 alone. It's worth noting that not all cases of diarrhea are reported, and many may not receive medical attention. In 2022, there were 117 reported outbreaks and 1,697 cases. Preventing diarrhea and foodborne illnesses in Sao Paulo requires taking certain precautions. Some of these include avoiding eating raw or undercooked meat and seafood, and ensuring that your food is properly cooked and stored. It is also advisable to drink bottled or boiled water and avoid drinking tap water or ice made from tap water. HIV/AIDS is a sexually transmitted infection that affects millions of people worldwide. Accordingly, with HIV data from epidemiological surveillance of Sao Paulo, in the first 2 months of 2023, there were 360 reported cases of AIDS in Sao Paulo City. In 2022, there were a total of 2,356 cases, with a higher prevalence in men than women. Preventing STDs and HIV in Sao Paulo involves practicing safe sex by using condoms and seeking medical attention promptly if you suspect you may have contracted an STD. Teleconsultation is a convenient option for STDs, and we can offer same-day appointments if you need it. teleconsultation with a doctor from Brazil as convenient and safe option. Sao Paulo is the largest city in Brazil and one of the most important economic centers in South America. It is a vibrant city that attracts many foreigners from around the world for business or tourism. The main international access to Sao Paulo is Guarulhos International Airport, which is located quite far from the city center, making teleconsultation a great option for those who are at Guarulhos Airport and in need of a medical consultation or access to prescription drugs, such as antibiotics, without having to navigate the city's busy traffic. Dengue, leptospirosis, meningococcal disease, influenza B, diarrheal diseases, some of the diseases that can be transmitted in Sao Paulo, especially during certain seasons of the year and on peripheric urban areas of the city. These diseases can start with similar symptoms, which can be confusing for doctors, especially for those who are not updated with the epidemiological situation and outbreaks on the city. So, it is very common when consulting a physician from high-developed countries, where some of these diseases are rare and the professional cannot have experienced any patient with that, to face diagnostic difficulties. It can also be challenging to diagnose and manage symptoms, drugs, and where to find specific lab exams. On the other hand, consulting local health services can be challenging to find a doctor who can understand clearly your symptoms description and speak in English. Fortunately, teleconsultation is now an option available with my Brazilian doctor for foreigners to improve access to a local doctor who speaks English. It is a convenient way to consult a doctor registered in Brazil who knows the epidemiological situation and has experience treating tropical diseases. The difficult to find an English-speaking doctor is frequently mentioned as an issue even for expats that live in Sao Paulo. A physician registered in Brazil can prescribe drugs available locally as well as request labs, and if necessary even make a proper referral to hospital in case you have indication for presential intervention. An experienced doctor who speaks English and can understand the details of your symptoms is essential for a proper diagnosis and treatment. Telemedicine can be a great tool to diagnose, prescribe, and if necessary, refer you to a local hospital to avoid misunderstandings. The doctor can provide a clear referral in Portuguese communicating your symptoms and a diagnostic hypothesis, which will help the hospital staff to provide the appropriate treatment. One of the benefits of teleconsultation is that you can have a medical consultation from the comfort of your own home or hotel. You do not need to travel to a clinic or hospital, which can be time-consuming and stressful, especially if you are not feeling well. You can also avoid the risk of exposure to other infectious diseases that you may encounter on a waiting room. It is even possible to have an individualized health checkup consultation with telemedicine service of my Brazilian doctor. Another advantage of teleconsultation is that it is less time and cost-consuming than a traditional medical consultation. You do not need to pay for unnecessary interventions, transportation, or parking, and the consultation fee is usually lower than a face-to-face consultation. In conclusion, teleconsultation is an excellent option for foreigners in Sao Paulo who need medical attention. It is a convenient, safe, and affordable way to consult a doctor who knows the epidemiological situation and can provide a proper diagnosis and treatment. If you are experiencing symptoms of any of the diseases transmitted in Sao Paulo, do not hesitate to contact us or ask for our same-day teleconsultation service.